everybody to a
What
happy. What's today? Tuesday? It's Tuesday.
It's someday.
It's quarantine. Who knows? Yeah. So yesterday we got to talk about some fibromyalgia, and the unfortunate reality is there's so many stinking people out there with fibromyalgia. Are you one of them? And the reality is, if you're not one of them, you know somebody who has it.
Yep.
Prevalent. Right? So yeah, what are we gonna talk about today? Got dogs. This is what when you work at home.
That's right. We got so stop it. So we're gonna talk. We're gonna dive into a test that I love, and I can almost guarantee you, if you come into us with fibromyalgia, we will definitely run this test on you. But this was an actual patient that came to our office with fibromyalgia, and she had been struggling with it for several years, and never did any doctor ever talk to her about addressing the immune system problems and really investigating gut health. And so, she looked at me a little cross-eyed when I told her I wanted to run a stool test on her, right? But you're going to see as we go through this test, there's no way this lady would have got well if these issues weren't addressed.
That's right.
And with fibromyalgia, a lot of people just associate pain with fibromyalgia, right? But in reality, a lot of other symptoms can come with fibromyalgia. A lot of patients will have, restless leg type stuff. They can even have anxiety, depression. Chronic pain is obviously the number one sign of it, but there's a lot of different things that are associated with it. But again, it all really comes down to your gut health, your immune system. And so again, that's why we run this stool test on just about everybody that comes into the office with any kind of autoimmune condition.
Right, that's right. Well, that being said, let's go over what this test is, okay? Yeah. Let's show it here, and you should be able to see that now. So that's up there. Tina says, I definitely want to rule this out. I've never been diagnosed by a regular doctor. Yeah, they don't take it. It's like, you're in pain, honey. Like, take these drugs. You're in pain. Don't worry about it. You're in pain. Obviously, it's in your head. You're depressed. Let's just put you on depression medications. And if you haven't gotten that far yet, Tina, I'm telling you, just wait, because it will happen. It is only a matter of time, because they don't know what to do with you. Again, me and Tina were actually texting this morning. So we got her set up, and we're rolling some stuff out anyways. But yeah, I can't wait to get those tests back. So, all right. So you can see that test. I'm trying to see if I can make it any bigger or not. I don't know that I can, but that's okay. Let's go ahead and talk about it. So, Doc, let's see. You go ahead and go. I'm going to see if I can move it around a little bit. We got to find out some new software here. So,
sure. Yep. So, I mean, the first page of this test is really an overview of the entire test. So we really like to. I personally don't spend too much time on the first page, but guys, this is such an awesome, comprehensive test. This first part here, again, this test doesn't just rule out infections, and that's what a lot of stool tests that are done in the medical world, they're just ruling out major infections. This one starts with digestion and absorption, so you can see here that it's a little. Okay, we can see it. Everybody can see that pretty good. But yeah, so we're looking at digestion absorption, guys. It's so important.
Playing from Amanda's iPhone.
Are you still there, Doc?
Yeah, no, I'm here. I'm just messing around with it.
Oh, okay, cool. So digestion, absorption, so important, guys. You can see protein here. We want to see these numbers in that mid-range. Again, if you're eating good quality proteins, if you're eating good quality fats, and you're not able to break them down, emulsify them, and absorb them, then again, your body's going to be so deficient. And we see a lot of patients that come in with, vitamin deficiencies or mineral deficiencies, different things like this. And at the end of the day, I really don't prefer to spend the money on testing vitamins and nutrients, because if you're low on it, well, guess what? We've got to find out why. And this page here will tell us a lot about why people aren't absorbing nutrients properly, because again, this is looking at how we digest them and break them down. So this person in particular, you can see that she's definitely not breaking down fats the way she should be. It goes down into the next area with a lot of immunology markers. So you're looking at immune system. Then we're looking at microbiome markers. So your good bacteria. Again, guys, with the gut, and I'm sure Doc would agree. They say we've got 1 trillion human cells, and then they say we've got about 10 times as many bacteria in our body. And so by no means do we think we can control the bacteria, right? We want to just create balance within the system. And your good bacteria, or the microbiome, is really what helps to maintain homeostasis and create balance in all of the other bacteria. The next page looks at all the commensal bacteria. And so commensal bacteria is bacteria that is supposed to be in the gut, but it's not part of your good bacteria. And again, with these bacteria, it's all about balance. And so you can see with this lady, see all the H's in red, the little red H's? Those mean that those bacteria have overgrown. And so typically what we'll see when you see overgrown or imbalance of a lot of these commensal bacteria, typically the good bacteria is very low. And that's going to have a major negative effect on that immune system function, right? And so see if I'm right on that, Doc. Go to the next page and see what her good bacteria levels look like.
Yeah, and it's unbelievable. And the thing is too, and we see this so often, these are people right here who are taking a probiotic.
Yep.
Because you are told that as long as you take a probiotic, you'll have good gut health. There's network marketing companies that just say, take this for the rest of your life. And I'm just like, the rest of your life, people have been on the same supplements for like 3 years, yet they're still sick. Or they've been on the things for 3 years and they finally are going to the bathroom. But guess what? Stop taking the supplement, stop taking the probiotic. What happens to your bowel movements? You don't go anymore. That is not fixing you. It's just treating a symptom. Maybe it is a naturaler source, maybe. But is it good and right for you? And that's the question, right? And so this woman, he just said, like, she's got no good gut bacteria. And I guarantee you she was eating things like yogurts and maybe some fermented things, and probably taking a probiotic, if not all the time, but definitely like at least some of the time. But whenever you're sick and you're imbalanced, and again, you look at medicine wants to look at this test and say, this is a simple fix, because all I need to do is give you a probiotic and maybe give you some like immune suppressors or something, or give you some pain pills to help with the pain, and you're going to be fine.
Right.
But guess what that will do? That will further cause more imbalance, take you further away from homeostasis. I said, your body is like a magnet. Here's homeostasis, right? It's like the camera's backwards, so I'm getting used to that. Homeostasis is right here. This is normal. This is no disease. This is no fibro. This is no thyroid. This is no autoimmune. But what happens over time is it gets out of normal. And you have to figure out what triggered it and caused it out of normal. And this is part of it right here. And as soon as you remove those triggers, it's like a magnet. It wants to go back to normal. Every single time. Your body was designed to be normal. It wants to be normal. You just don't allow it to be normal because you do so much stuff to cause imbalances. And I'm gonna let him go back on this and finish this up, because I want to talk about what actually causes imbalances. Because if we're saying it's not just taking a probiotic to fix it, now it's a part of it. Sometimes you have to take a probiotic, right? Not forever, but you also have to stop doing things to reduce and stop causing damage to your microbiome as well, which is probably important.
Yeah, and you're right, Doc, and that's so true. It's more important to ask the question, what are we doing to devastate our good bacteria versus what do we need to do to get it back up? Because just like you said, I mean, most people are taking probiotics because of their gut issues, and look, they still have no good bacteria. So the top markers you want to see, you can see it says +1, +2, +3, +4. The NG stands for no growth. So this lady had no growth of 2 of the strains of good bacteria. And then her other one was only a +2. And so, a strong growth is a +3, a +4. And speaking of that, you can see the where it says additional bacteria. These are 4 strains of bacteria that are not supposed to be in the gut, not normally found there. So, and you can see they're all +4s. So this is not something that happened overnight. And this is why this lady has been struggling with inflammatory diseases her whole life, because she's got major overgrowth of infectious bacteria. She's got no good bacteria. And then the balance within the system is completely lost. And so again, if this is not addressed, the inflammation will never get under control. The pain will never get under control. The anxiety, the depression, the weight issues, all of these things will never go away. And it's constant frustration by these patients because a lot of them are trying to do the best they can and they're just spinning their wheels. And it's just, man, it's so frustrating. So again, guys, I love this test because you got to start with the basics. And if you don't have a healthy gut, you're going to be spinning your wheels with just about every approach. Would you agree, Doc?
Yeah, 100%. You got to do something. You got to do something about it. So what I did is I just in the comments, I put a link to schedule a phone call with myself or with Dr. Miller. All you got to do is click it because there's people here in Lexington. Well, gosh, we're shut down, but we can do everything virtually and remotely. That doesn't change anything. We are still working every single day and we haven't slowed down because there's so many gosh darn sick people that are looking for hope, help, and answers. Remember, I said hope is just simply the definition that tomorrow will be better than today, but none of you guys have that hope right now. And that's a scary place to be. So if you're sick of being sick, if you have stomach issues, digestive issues, if you have fibromyalgia or somebody you know, they need to get on the phone with us ASAP because we got to start fixing it. You are not going to get better sitting in quarantine, feeling sorry for yourself and eating a bunch of sugar and food and not drinking water and not exercising and just sitting inside your toxic home. You're not going to get better that way. You're going to get better by picking up the phone or by using this link and scheduling a call. Let's figure out, let's get a plan. And let me tell you this, he said like we run this on most people that have fibromyalgia because there's such a, you can't have good health if you don't have good gut health. But does every single person with fibromyalgia get this test? No, not necessarily. Everybody's different. But we have to find out what your triggers are. And a lot of times those triggers come from these infections right here in your stomach. Or maybe it's yeast, or maybe, and he was probably trying to get there, sometimes there's people that have these little guys in you. You know what those things are? Who knows what that is? I'll give you a hint. They love a full moon.
Yes, they do.
Love a full moon. Those are called parasites. Parasites. So not only do they have bacterial infections, but they've got parasitic infections as well. So this person is just sick. And guess what happens when you're sick like that and you have that much stuff and you have no defense with your good bacteria, your body is going to start attacking itself and it's going to show up differently in different people. With these people, with fibromyalgia type people, what happens is that gut lining gets eaten away and all of a sudden these bacteria and these viruses and these parasites and things get into the bloodstream. And now that it's in the bloodstream, well, your body starts attacking it. And that's the same thing. That's why I like to combine this with a food allergy test. She says she can't see it. I'll put a little bit bigger for you here. So the thing is we have to find those triggers. And I like to combine this test with a food allergy test because food allergies is the simple process of you just not breaking down all your foods and proteins, specifically the proteins, them getting into the bloodstream, into the small intestine, into the bloodstream, and then your body triggers inflammation. Your body starts attacking it. Your body is literally attacking itself from broccoli, cauliflower, lettuce, rice, tomatoes, onions, garlic, pepper, rice, almonds, peanuts, soy, wheat, dairy, eggs, cheese, and lentils, beans, and so on and so forth. And why I say that is because those were my food allergies and I had no freaking idea about it. You know, it's just absolutely crazy that you could be eating healthy food, but yet it's not healthy for you, right? And so you got to be very careful with nutrition and all these people saying, well, just eat this way, just do that way. Well, you have to eat what's right for you and for your body. And the only way to know that is through testing. But this test is so important if you truly want to find triggers. Another thing that this doesn't test, and it's patient specific, is viruses. And viruses can play a big role in fibromyalgia. My wife, when she had fibromyalgia symptoms come back, it was mostly due to Epstein-Barr or mono. And Epstein-Barr and mono is something that's going to be on you, in you all the time, but it doesn't have to be active and cause damage and harm. What causes it? What is one of the biggest things that will cause Epstein-Barr or other viral infections to become active in you? Does anybody know? Stress. Stress will activate it. For my wife, it was having a baby. You think that's a traumatic, stressful time? You think not sleeping forever is a traumatic, stressful time? Ask me right now. I'm going through it, right? And so it is. But again, we got to start taking care of ourselves. We got to do something. So make sure you guys click that link and go ahead and schedule. We're actually doing free phone consults initial consults for people just to find out, what we can do, because we know there's just too many sick people out there. So take advantage of it, because I promise you, it's not always free. And we're doing it this way just because we want to help, and we want to give people back, and we want you to have the opportunity to find different answers.
Yep. You guys need to find a doc that's going to customize a treatment plan based off of why you're sick. There is no one diet. There is no one herb. There is no one plan that's going to work for everybody.
Right.
And you can see all the different variables on just this one test. And we've got many different tests that we run. So what's going to fix and make your fibromyalgia symptoms go away is going to be completely different for the next person. And that's what Doc's saying. You got to find somebody. You got to find a wellness way doc. Reach out to us. We work with people all over the country, really all over the world. I mean, we've helped a lot of people outside the country as well. So, reach out to us, guys. We can. The good thing about this is you can poop in the convenience of your own home and send it off to our lab, and the labs are still running full steam ahead. So, this is something that you can get done right now.
Yeah. And guys, I just tell you this, like, if you're in pain, I get it. I mean, I'm like as close to Superman as you could meet, but like even sometimes I get hurt or, feel under the weather and stuff as well. And so when you're in pain, I understand how terrible it is. I understand how terrible you feel. I understand how you don't want to talk with anybody, how you don't want to come to webinars or go to appointments, or you don't want to do anything but get out of bed, and maybe now you're drinking alcohol and stuff to kind of help to, cover some of those things. That is such a terrible way to live life. And if that's you and that's how you live, and again, we're in quarantine right now, but we're not going to always be in quarantine. How many more soccer games? How many more baseball games? How many more graduations and weddings and trips and vacations and things do you have to miss before you finally say enough is enough? It drives me crazy, especially men, because men are flipping idiots. And men have to wait, and we can say it because we're men. And I know how much of an idiot both he and I are, right? And what we want to wait and say nothing's wrong until all of a sudden you have cancer? You want to wait till you have cancer before you want to make a change? You want to wait till you're full-blown diagnosed with fibromyalgia? You want to wait till you have irritable bowel syndrome, or even worse, Start taking control of your health right now. And again, this time is like the best time in the world to do these kind of things, because you have time and you can focus, and we can sit there, and we've got a nutritionist that will literally help you with, like, from click list, what to buy, how to buy, what to click, and just go pick it up, recipes and things to be able to make with quarantine that's going to be able to make for long periods of time and feed your entire family. We have exercise programs and different exercises that we do. We've done them like the last couple of weeks. If you guys want to do more, we'll do more. We'll put one together soon again. But like, we're giving you all the stuff that you need, but you have to get tested in order to truly reach and take that next step to that next level if you want to get better. So,
yep.
Very good. Awesome. Well, we'll keep talking about fibromyalgia. I think this is a good topic, and a lot of people are interested in it. And again, people just don't know. It's like, it's not just an autoimmune condition you have to live with the rest of your life. You're not just going to have to suffer the rest of your life. You can get hope, you can get help, but you have to look somewhere different. And we look forward to helping you. Again, our links are both in there to schedule phone consults with us. Pass those around. Send those links to anybody, your friends, your family that needs it, because we would love to chat with them and show you what we can do to help you out. So awesome. Appreciate the heck out of you guys watching. Like, share, comment this thing around, because people are looking for this stuff everywhere.
Right on.
Peace out, Al.
All right, Doc.